Hi everyone, my name is Domenica Benitez and I'm going to talk about Ivabradine in Catecholamine Induced Tachycardia in a patient with paraganglioma. Okay, definition. The first thing is to define the paraganglioma. Paraganglioma is a type of neuroendocrine tumor that forms near certain blood vessels and nerves outside of the adrenal glands, which are important for making hormones that control many functions in the body and are located on top of the kidneys. Paraganglioma is related clinically to sequelae results from catecholamine secretion that is able to cause hypertension, tachycardia, multiple organ failure, and death. And now I'm going to define ivabradine, that is decreases heart rate due to selective and specific inhibition of cardiac pacemaker if current, which controls spontaneous systolic despolarization in the sinus node and regulates heart rate. Applications in medicine. It is usually used to treat adults who have chronic heart failure to reduce the risk of hospitalization for worsening heart failure. It is also used to treat heart failure in children 6 months of age and older who have stable heart failure, with symptoms caused by enlarged heart. Also, the use of ivabradine, that is considered a current inhibitor to manage tachycardia and heart failure due to massive catecholamine release in a patient with a metastatic paraganglioma. I continue with a
Medicosis Perfectionalis, where medicine makes perfect sense. Today we have a crazy mnemonic about Ivabradine, which is used for CHF and angina. With that being said, now let's get started. Ivabradine, what's the mechanism of action? It inhibits the pacemaker current, also known as the funny current or the funny channels. These are very funny. And they are responsible for the automaticity of your SA node and AV node. That's why your heart can pump on its own. But how about the sympathetic and the parasympathetic innervation? This is to speed up the heart or to slow down the heart, but not to initiate the impulse. The impulse initiates from within. Hashtag automaticity. When you inhibit the pacemaker current, you will end up with low heart rate. Imagine my shock. What are the clinical uses? You have angina and CHF. Like any patient with angina? No, when patients cannot take beta blockers. Any patient with CHF? No, when the left ventricular ejection fraction is less than 35% in a patient where beta blockers are not enough. Beta blockers never good enough. When you give Ivabradine, give Ivabradine. I'm a stupid idiot. What are the side effects of Ivabradine? Bradycardia? Because of course when you slow down the heart, this is called bradycardia. AV nodal block, which is the same thing as bradycardia because, the problem here is in the AV node. When you slow down the AV node, you will get an AV nodal block. Hashtag heart block. Luminous phenomenon. Why? Because there are funny channels in your retina. Not only the heart, but also the retina. Your retina is hilarious. Drug-drug interactions. Do not give ivabradine with a CYP450 inhibitors, the cytochrome P450 inhibitors. Why? There is an interaction. Both of them will interact in the liver. Verapamil and diltiazem, you can get similar things. Ivabradine, symptomatic management only, as effective as beta blockers or calcium channel blockers, but please do not forget it does not lower mortality in angina or CHF. It's just for symptomatic management. It does not improve survival. It does not decrease mortality.
okay about pros and cons. About pros, ivabradine is able to reduce heart rate through selective inhibition of pacemaker current. And cons, ivabradine have adverse effects like hyperuricemia, headache, eosinophilia, bradycardia, dizziness, nausea, phosphonates, impaired vision, and dizziness. And continue with a video that explains this.
So we have seen that ivabradine is useful in the patients with stable chronic heart failure. In these patients, because of heart failure, the cardiac output is somewhat reduced. So when the heart is going to contract, it is going to eject the blood, and whatever the fraction of the blood that is going to be ejected out of the left ventricles can be denoted as left ventricular ejection fraction. And when this LVEF is less than or equal to 35%, it indicates a serious heart failure in the patients. This condition in the patients may stimulate few of the pathways, resulting in the stimulation of sympathetic system as well as increase in the automaticity. So by these mechanisms, catecholamines are released and they can act on the heart, thereby heart rate is going to be increased. So in these patients with left ventricular ejection fraction less than or equal to 35%, we can observe increased heart rate, irregular heartbeats as well as cardiac arrest in the patients. So in order to control these complications, ivabradine can be used, which can act on the pacemaker cells, thereby to reduce the heart rate, preventing irregular heartbeats as well as cardiac arrest in the patients. So ivabradine is useful in the patients who are having stable chronic heart failure. So ivabradine can be used in these patients which reduce the risk of unstable heart failure as well as sudden cardiac arrest in the patients. Particularly, this drug is useful in the patients who are having left ventricular ejection fraction less than or equal to 35% and the patients with sinus rhythm greater than or equal to 70 beats per minute where the heart rate is increased, and in those patients where the beta blockers are ineffective. For instance, if a patient is given with the beta blockers and the maximum dose is achieved but still heart rate is not controlled, in such patients ivabradine can be given. And finally, this drug can also be given in the patients who are contraindicated with beta blockers. For instance, beta blockers at a high dose, they produce bronchospasm and they are contraindicated in asthmatic patients. So in such patients or in any other contraindication of beta blockers, ivabradine can be given in order to control the heart rate in the patients.
About applying in Ecuador is reduce the risk of HF, hospitalization, and cardiac death in patients with left ventricular ejection fraction uh, less than or equal to 35%. For patients in sinus rhythm, ivabradine has a theoretical benefit in patients with AF, uh, given its mechanism of action. And continue with the video about this.
The most common side effect you might experience with this drug is changes in your vision. Serious side effects that require medical attention include allergic reactions such as rash, itching, swelling of face, lips, or tongue, high blood pressure, fast or irregular heartbeat, feeling of faint or lightheadedness, as well as unusually low heart.
Finally, in conclusion, Ibabradine's mechanism of action suggests a theoretical benefit in patients with IF. However, data supporting its use is limited. One case report demonstrated the utility of Ivabradine is slowing HR in a patient with IF with RVR with coexisting HF with reduced LVEF.